What are the lessons that you think we've learned and that we haven't learned, but we need to learn for this horrible pandemic?
Ian, people always talk about lessons learned. I think we should be talking about lessons that we'd better learn. And I think there are three of them for COVID. I'll call them the 3 R's. That we need a renaissance in our public health system. We need a robust primary healthcare system. And we need resilient populations in terms of health resilience and in terms of societal resilience. And just briefly taking those one by one, a renaissance in public health. We need to invest in public health. We need to make sure state, local, city, county levels are aligned along with global levels. We need to make sure that public health has good engagement with communities, all communities in our society. In terms of primary healthcare, unless we have good primary healthcare, and we do not in this country, unless we do, we're not going to be able to detect things promptly. We can't diagnose and treat. Use Paxlovid, for example. We can't get people vaccinated effectively. We still have tens of millions of vulnerable people who are not up to date with their vaccination. Primary healthcare is so important, but so underfunded in our system. And third is resilient populations. That means healthier, so chronic diseases in good care, tobacco use decreasing, hypertension in control, diabetes in control. That means that if there is an infectious disease shock, we're more likely to be able to withstand it, and resilient in terms of trust. Trust is the one thing that you cannot surge during an emergency. We need to rebuild that. We need to rebuild some of our common platform of understanding.
Now, look, I saw the movie Contagion, and I saw it again right at the beginning of the pandemic, and the CDC, they were heroes in that film. And at the beginning of the pandemic, it certainly looked like people like Dr. Fauci and the CDC were very widely respected in the United States. I don't think you can say that today, and you've just kind of intimated that. Where do you think they've gone wrong, and what concretely needs to happen? What could happen that could help to rebuild that trust for the American public?
Well, first, Ian, just about Contagion. It was filmed at CDC. I got to meet Matt Damon, Lawrence Fishburne, and others, which was pretty exciting. And the movie is pretty accurate. Interestingly, the one thing that many people criticized it for at the time was, oh, they'll never produce a vaccine so quickly during a pandemic. And here we are with mRNA technologies and a stunningly effective vaccine. In terms of rebuilding trust in the CDC and in government more widely, it's very important that CDC reestablish its identity in separation from the White House, whoever's in the White House. Because if all or most of the CDC press conferences are done as part of the White House, then a big part of the country, whichever side is in charge in the White House, is not going to believe what they say. CDC is in Atlanta. It has advantages and disadvantages, but that separation can be very powerful. Second, CDC needs to follow its own playbook, as I think it's been increasingly doing. Be first, be right, be credible, be empathetic, and give people proven practical things to do to protect themselves and their family. And third, have some successes. Nothing succeeds like success. And as CDC, which is doing great work, which still has thousands and thousands of people who dedicate their lives to protecting Americans 24/7. As those successes become apparent, I think trust can be rebuilt.